Here's a shift worth noting. Better healthcare is care that meets patients where they are. United Health Group is bringing it directly to living rooms. This is a win for patients managing chronic conditions. And here's the interesting thing. By closing those care gaps, administering in-home exams, and identifying risks earlier, more diseases can be prevented and patient outcomes can improve. In 2025 alone, United Health Group patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
From furniture to tableware, the best for outdoor living is at Paragold, the destination for luxury home. Elevate how you go al fresco with quality pieces in every style from design's best brands. Shop our largest ever selection and enjoy free, fast, full-service delivery on most items, in-store and online at Paragold.com.
In the year 2000, America declared that the measles virus was eliminated in the U.S. One of the most contagious diseases had finally been conquered, primarily through widespread use of the vaccine. Prior to this achievement, the CDC reports that nearly all kids got measles, experiencing the hallmark symptoms like cough, conjunctivitis, and coryza.
Coryza just means kind of like a runny nose sort of thing. But the most diagnostic feature for measles is the rash that we talk about. This is something that classically kind of starts at the top of the head and moves down over the body, where you'll have these little kind of red patches that'll appear all over the body. They won't really be itchy or anything like that, and then they'll just resolve over time.
That's Dr. Ben Bradley, assistant professor of pathology at the University of Utah. He's also the medical director at ARUP Laboratories. Despite the historic announcement more than 2 decades ago, the disease has made a comeback in recent years. Last year, America reported the most cases we've seen in more than 3 decades, and we're on pace to break that record in 2026.
What's kind of interesting is that, we haven't really seen measles in the U.S. in 50 years. So really any practicing clinician at this point isn't as familiar with measles as we used to be back in the day, where a GP would see a kid come in and they'd be a mile away. I know that's measles.
Which means making an accurate diagnosis is a bit more challenging now. However, catching measles early doesn't reduce how dangerous it can be. There's no real treatment for the virus. Patients can only hope to manage their symptoms by staying hydrated and taking medication to reduce their fever. But for some, a rash is only the beginning. 1 in 5 unvaccinated people are hospitalized due to more severe complications.
One of the more common ones is a pneumonia, so an inflammation of the lower part of the lungs. And so that can complicate breathing, make it difficult, especially for very young babies or young children that don't have kind of as big of a lungs as we have in adults. They'll have more trouble breathing. Another problem that we can see from measles infections is something called meningitis or encephalitis. So infection of the brain or the tissues covering the brains. And this can, again, sometimes lead to fatal outcomes in these patients. I think it's about 1% of children who progress to this kind of encephalitis will pass away from that disease. So this isn't something that's just kind of a rash that comes and goes.
The CDC reports that for every 1,000 kids that are infected, 1 to 3 will die from respiratory or neurologic complications. And as we mentioned earlier, measles is highly contagious. Infected people become a danger to everyone around them 4 days before a rash appears, which is probably before they realize what virus they've contracted.
One way that we look at the transmissibility of viruses is by using this value we call R0. And that basically says for each person who's infected with a virus, with a pathogen, how many other people will they spread that to? And for measles virus in an unvaccinated population, the R0 is somewhere around 15. So that means for every 1 person that has measles, another 15 are going to get infected from that person. And so you could see how if a person with measles were to enter into a population or an area with low vaccine coverage, you could just have an exponential takeoff of cases. So that's another big challenge with what makes measles so dangerous is it's very hard to control if we don't have that 95% or greater vaccine coverage within a population.
A common thought, particularly from older generations, is that everyone used to get it and most turned out just fine. So why do we need a vaccine? Aside from the fact that we can prevent more deaths and cases of illness, Bradley notes that there's a less common complication from contracting measles that can sneak up years later.
One of the more rare complications of measles infection is this condition called subacute sclerosing panencephalitis, or SSPE. And what this is a condition that will develop maybe 5 to 10 years after somebody's recovered from measles. And it's this progressive neurological deterioration. So it makes it difficult for people to move, to speak, to be able to think clearly. And generally, over the span of about a year or so, patients die from this.
Bradley says there's no treatment that can prevent SSPE from progressing. And according to recent research, the disease only affects people directly infected with measles. The lab-adapted strains used in the vaccine do not cause SSPE.
Essentially, what happens is the virus has latently infected the brain, and the virus is no longer capable of spreading between humans. It forms essentially what we call defective viral particles, but it's still able to replicate its genome and move between cells in the brain. So it's still causing this low-level inflammation. And in these cases of SSPE, what we can do is, after a patient has passed away, perform an autopsy, look at their brain tissue, and actually find those measles proteins still present in the brain. And so that's how we've been able to kind of figure out what this entity is.
While researchers believed cases of SSPE were far and few between, Bradley says newer data is showing it's not as uncommon as they hoped.
Initially, we thought that SSPE was something incredibly rare, 1 in 100,000 or something like that. But as we've gotten better data for this, and as we've been able to look at younger populations, the likelihood of this happening is probably closer to something like 1 in 2,000, 1 in 4,000, especially for very young kids, so 1 to 2 years old. And it's my kind of worry that we're going to see more of these SSPE cases in the coming years because of how many measles cases we've had with this current outbreak.
Unfortunately, SSPE isn't the only long-term complication that can come from measles. The virus can also wipe out the body's memory cells, causing immune amnesia.
Within you and I, we have these antibodies against all these different pathogens that we've kind of acquired over time by getting sick or, being exposed to something, and maybe we had a sore throat for a day or two, but we've developed antibodies to this. We sort of have this almost deck of cards of different antibodies to different pathogens. And what we've observed in patients who have had acute measles virus infection is that kind of deck of cards, that repertoire that they have. The measles virus sort of reduces the cards that are available to them. It essentially lowers their antibodies to all of these other pathogens that they've developed immunity to.
Meaning that the body is much more vulnerable to other infectious diseases because the immune system no longer remembers how to fight off those infections. This weakened state typically lasts about a year, but it can take up to 5 years for the immune system to fully recover.
This has been looked at in large population data sets using data from the US and some European countries. And what you'll see is that after you have a big spike of measles cases, for the next year or so, there's a higher percent of deaths due to infectious diseases, just kind of generically.
Measles cases are on the rise both in America and around the world. This surge has been caused by a decrease in vaccination rates, which Bradley attributes to a few different factors.
Certainly, vaccine hesitancy is one that we worry about. Sometimes just access to healthcare. So for countries that may be having political unrest or disruption or war, they may not just be able to access their physician like you or I can and go in for their daily checkup, or young kids may not be getting brought to the doctor for their routine shots. So sometimes these social and political events that happen too just reduce the exposure to children getting their vaccines. A great example would be COVID-19, when everybody was kind of sheltering in place and everything. What we saw was that kind of globally, a lot of kids missed the shots that they needed to be getting for those years because they weren't going to the doctor for a year or two. And now, while a lot of them did catch up, many of them did not return to their pre-COVID baseline for the number of vaccines. So kind of globally, we've just had a decrease in MMR coverage for that reason as well.
Vaccine hesitancy has been on the rise for several years due to misinformation and an overall distrust of public health institutions. There are side effects that can occur from the measles vaccine, but there's a lot of myths about what those side effects are.
Again, this is, a live attenuated virus, so kids can develop kind of mild, almost measles-like symptoms. They may have fever. They may be uncomfortable for a little while. Some kids actually even develop a rash that looks like measles after they've gotten the MMR vaccine. But it's important to remember that these kids are not infectious. They're not going to transmit it to someone who's immunocompromised.
Any medical decision is about weighing the pros and cons. While the measles vaccine has been proven to be safe for most people, there are extremely rare side effects that can occur. That includes severe allergic reactions, temporary low blood platelet count, and fever-induced seizures that, while certainly scary to witness, are usually harmless. There is no known association with autism or developmental delays.
And I think another thing that we don't really mention about measles is a virus that only spreads between humans. So it's not like something like influenza that infects animals and has these reservoirs that spill back over into people. Measles is really just conditioned to circulate between humans. And if we were all vaccinated and we prevented the spread of measles, we could actually eliminate measles. And so worldwide, you would never see it again. It would be gone. And I think that's another big reason to say kind of, here's the advantage of taking this vaccine is because if we all do this together for a decade or so, we can make it go away. And then we just don't have to worry about it. And then you don't have to get vaccinated for it anymore because it doesn't exist.
You can find more information about Dr. Ben Bradley and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.
From furniture to tableware, the best for outdoor living is at Paragold, the destination for luxury home. Elevate how you go al fresco with quality pieces in every style from design's best brands. Shop our largest ever selection and enjoy free, fast, full-service delivery on most items, in-store and online at Paragold.com.
Did you know about 1 in 3 people with plaque psoriasis may also develop psoriatic arthritis, which causes joint pain, stiffness, and swelling? Does this sound like you? Listen to what it sounds like to be a million miles away. Tremfya, guselkumab, taken by injection, is a prescription medicine for adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills or phototherapy, and for adults with active psoriatic arthritis. Serious allergic reactions and increased risk of infections and liver problems may occur. Before treatment, your doctor should check you for infections and tuberculosis. Tell your doctor if you have an infection, flu-like symptoms, or if you need a vaccine. Imagine being a million miles away. Explore what's possible. Ask your doctor about Tremfya. Tap this ad to learn more about Tremfya, including important safety information.
Burlington knows you cannot forget Mother's Day. And be real, texting your sibling to add your name to their card isn't enough. Instead, head to your newly refreshed Burlington, where it's easier to shop for deals that'll make mom proud. Find fragrances from perfume to candles or opt for a brand name bag. Plus, your store had a glow up, so it's more fun to shop for those special women in your life. Mom is wow upside down after all. Burlington, deals, brands, wow.